The title of the article that this research blog wants to review is called Individual Gender and Group Gender Composition as Predictors of Differential Benefit from Mindfulness-Based Relapse Prevention for Substance Use Disorders. The aim of this research blog is to describe this as one would to a client who may be about to start group therapy for substance use disorders and trying to come up with the type of group that they wish to put that person into. The purpose of this article is to look at the effects of sex and gender on substance use disorders, specifically the effects on the addiction treatment or substance use disorder treatment in group therapy. Group therapy can consist of gender composition and the gender of the individual, and both of those can really affect the treatment experience. Gender composition or group gender composition is how many males or females make up the group. And group composition could greatly impact group cohesion. Group cohesion is this idea of the group working together to satisfy a goal of the group or the specific needs of a member of the group. Group cohesion has been associated with improved outcomes in group therapy. There have been a few studies that compare single gender groups versus mixed gender groups. Single gender groups are groups consisting of only males or only females, whereas mixed gender groups are one group consisting of a mixture of females and males. One study found that women actually experienced fewer substance use days in single gender groups compared to mixed gender groups. Another study found that the number of affiliative statements were higher in women's single gender groups. Affiliative statements can consist of things like supportive statements, which is one individual supporting another individual in the group. Or it consists of acknowledgement of shared experiences. So one individual is telling a story about something they've experienced, and another individual is agreeing with them, saying that they've experienced the same thing. Another aspect of affiliative statements is strategy suggestions. So one member of the group can give suggestions to the other member of the group on strategies they can employ to help with the problem that they're dealing with. The results of these studies lead to the conclusion that maybe the amount of women in a group can influence the group cohesion. The current study wants to compare two treatment conditions. One of them is mindfulness-based relapse prevention, or MBRP. MBRP is made up of mindfulness meditation training combined with cognitive behavioral relapse prevention. Cognitive behavioral relapse prevention on its own is the second treatment condition that the study is looking at. So MBRPs, in terms of mindfulness meditation training, that's the idea of focusing your mind on your experiences, thoughts, emotions, and sensations in the present moment. So it'll involve breathing practices, mental imagery, body and mind awareness, or body relaxation. Cognitive behavioral relapse prevention focuses on teaching participants coping and problem-solving skills to manage key triggers and life stressors. There has been some research on individual gender specifically as a moderator of substance use disorder treatment outcomes. However, there are no studies that have examined group gender composition as a moderator of the treatment outcomes of substance use disorders. This study aims to evaluate both as potential moderators in a very large randomized trial. The results of this study found that individuals who received mindfulness-based relapse prevention, or MBRP, had fewer substance use days a year after the treatment compared with those who received just regular relapse prevention. This effect was greatest when the group consisted of 1/3 or more of women. There was no significant effect of individual gender on treatment, meaning that it was not the case that only women but not men benefited from being in these groups with 1/3 or more of women. There was one major limitation of this study, and this was the fact that gender identity or sex assigned at birth, this type of data was not collected, and this could have a huge impact on the type of group cohesion that there is or the group dynamics of the therapy. But the major study or the major finding that is found in the study is that in groups of 1/3 women or more, MBRP could optimize the effects on substance use outcomes. This could be a really important finding in determining whether or not or what type of group that a client could be put into. So if a person is really looking to optimize their group therapy, they could possibly be put into groups that have 1/3 women or more, male or female, and that have MBRP as a major aspect of treatment.